Okay, so we have our patient here, Miss Jones. Upon entering to the room, I'm going to perform hand hygiene. So I'm in the patient's room now. Hi, Miss Jones. My name is Morgan. I'm going to be your nurse for today. Can you please tell me your name and date of birth? Good, thank you. So we're just going to perform a head to toe assessment. It shouldn't take no more than 15 minutes. Is that okay? Okay, thank you. Can you tell me where you are and why are you here? Okay, good. First, I'm going to start by inspecting the skin, checking the color, making sure everything looks fine. So everything does look fine in that aspect when I first lay eyes on my patient. Next, I'm going to check the eyes. I'm going to have my patient look forward. And we're just going to check that the pupils are equal and reactive to light. And they are. That's good. Can you just open your mouth for me and stick your tongue out? I'm going to check your mucous membranes in your mouth. Okay, mucous membranes are light pink in color, moist, intact, no scarring, lesions, or anything. It's the same for the eyes. Eyes don't have any discoloration. They aren't dry or anything like that. Okay, next, I am just going to listen for your heart. I mean, not heart sounds, I'm sorry, breath sounds. Can you sit up for me? I'll have my patient sit up at the edge of the bed so that I can have the back exposed to listen to the lungs, not the lung sounds, but the breath sounds. And I'll have my patient breathe in and out as I place my stethoscope on each part, on both parts of the patient's back. In and out. In and out. Okay, so you can lay back in the bed. Breath sounds are clear. We don't hear anything adventitious, which is good. Next, I'm going to go ahead and check your heart. Listen for heart sounds. So, with the diaphragm, checking apical pulse. Okay, listening now with the bell. Okay, heart sounds are normal. We don't hear any murmurs or any bruise, so that's good. Next, I'm just gonna listen to your heart for a full minute, okay? Okay, we have 55 breaths per minute, which is good. Okay, just gonna cover you back up where you need to be covered. Okay, next I'm just going to inspect the abdomen. Aren't any lesions or anything, no irregular hair distribution, no any irregular color. Everything seems to be symmetric. Next after that, I am going to just palpate lightly. And I'm palpating in all regions of the abdomen. Okay, upon palpation, everything seems to be normal. There aren't any protruding masses, any irregularities with organs, and skin feels to be intact, and it appears to be intact, as well as the temperature. The temperature is warm, which is good. Temperature of the upper body is warm. There isn't any excess perspiration, or the skin is excessively dry, so that is good. Okay, next I'm just going to check your radial pulse, and I'm going to count for 30 seconds. Okay, good. So pulse rate is good. We have a pulse of 25 per minute. Next, I'm just going to ask you to squeeze my fingers. Squeeze them as tight as you can. Squeeze, 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 squeeze. Okay, good. Next, I'm just going to palpate, checking for any edema. Make sure the skin is good on your arms. Okay, cover my patient back up. Next, I'm just going to check your legs. Okay, checking the pedal pulse. For 30 seconds. Okay, our pedal pulse matches the same as the one that we took. I have a radial pulse, and I'm just inspecting the legs. Sorry, just inspecting the legs. My patient is covered up here. Inspecting the legs. Color looks fine. No irregular hair distribution. Legs seem to be symmetric on both sides. Aren't any lesions or anything on the legs. Now I'm just palpating the legs, feeling for any abnormal irregularities under the skin, as well as feeling for temperature. Texture feels normal as well. And I am going to press down slightly, a little pinch, just checking for any edema. There isn't any edema there. I'm going to ask the patient to flex their toes and resist me pulling. Or I can ask them to hold their legs up in the air for at least 10 seconds. So I'm going to cover the patient back up. That was fine. Okay, next I'm just going to ask my patient to roll over so I can check their pressure points while laying in bed. Skin is intact on the buttocks. The heels of the feet also look fine. Hips look fine. And the back is fine as well. Everything is dry. So, skin is intact. I'm going to place my patient at the lowest position. I'm going to place the call light back into the bed. Make sure my patient is fully clothed. Ask them if they have any questions. And then I'm going to go and document my findings. And then, yeah, we are good. And ask the patient about any irregularities that I might see while doing the assessment, just to get more clarification. Okie dokie.